everyone, welcome back to Injecting Knowledge. I'm Nurse Kaylee, and today we're going to be talking about a very crucial topic, shock and its different types. Shock is a life-threatening condition that requires early recognition and intervention. So grab your notes and let's get into it. Shock is a state of inadequate tissue perfusion where the body isn't getting enough oxygen and nutrients to function properly. If left untreated, it can lead to organ failure and even death. There are several types of shock, each with different causes, but all result in poor perfusion. Let's break them down one by one. First up, hypovolemic shock. This occurs when there's a significant loss of blood or fluids, leading to a drop in circulating volume. Think of trauma, hemorrhage, severe dehydration, or burns. Signs and symptoms include tachycardia, hypotension, cool and clammy skin, decreased urine output, and altered mental status. Nursing interventions include fluid resuscitation, such as IV fluids and blood transfusion if needed, oxygen therapy, and stop the source of fluid loss. In other words, stop the bleeding. Next, we have septic shock, caused by severe infection that leads to systemic inflammation and vasodilation. This type of shock is common in immunocompromised patients, those with pneumonia, UTIs, or post-surgical infections. Signs and symptoms of septic shock include persistent hypotension despite fluids, fever or hypothermia, tachycardia, warm, flushed skin in the early stages, or cold mottled skin in the late stages, and altered mental status. Nursing interventions for septic shock include: number 1, administer IV fluids. Number 2, start broad-spectrum antibiotics ASAP. Number 3, provide oxygen therapy. And number 4, monitor lactate levels. Neurogenic shock happens when there's a loss of sympathetic tone due to spinal cord injury, brain trauma, or spinal anesthesia. Unlike other types of shock, this one presents with bradycardia instead of tachycardia. Remember this for NCLEX and nursing exams. Signs and symptoms of neurogenic shock include hypotension, bradycardia, warm, dry skin, and loss of temperature regulation. Nursing interventions include stabilize the spine if due to trauma, administer IV fluids, administer vasopressors to maintain blood pressure, and also administer atropine for bradycardia if necessary. Lastly, anaphylactic shock, a severe allergic reaction that leads to massive vasodilation, airway swelling, and bronchospasms. Common triggers include food, insect stings, medications, and latex. Signs and symptoms of anaphylactic shock include sudden hypotension, difficulty breathing, swelling of the face, lips, or throat, hives and itching, and wheezing and stridor. Nursing interventions for anaphylactic shock. First, we want to administer epinephrine IM immediately. Then, we want to provide oxygen therapy. We also want to administer antihistamines and corticosteroids, as well as IV fluids to support blood pressure, and also continuous airway monitoring. I know I said that anaphylactic shock was the last one, but I almost forgot one of the most important, which is cardiogenic shock. This is caused by the heart's inability to pump blood effectively. People who are at risk are people who have heart failure, myocarditis, or myocardial infarction. Signs and symptoms include hypotension, tachycardia, cool and clammy skin, low urine output, and confusion, as well as chest pain and dyspnea. As far as treatment goes, we want to administer inotropes such as dobutamine and dopamine. We also want to place them on mechanical support devices and revascularization if it's due from a heart attack. We also want to give diuretics to decrease preload. Do not give fluids. and we may want to give them isosorbide or nitroglycerin as vasodilators. This will decrease the afterload. All right, that wraps up our breakdown of shock and its different types. Remember, early recognition and intervention are key to preventing organ failure and death. Let me know in the comments if you found this helpful, and don't forget to like, subscribe, and hit that notification bell so you don't miss any future videos. Until next time, thanks for watching, and I'll see you in the next video. Bye, guys.